If you're waking up 3, 4, even 6 times a night just to urinate, if you've started planning your day around where the nearest bathroom is, if your urine stream feels weaker than it used to, or you stand there waiting and waiting for something to happen, then listen to me very carefully, because what I'm about to tell you may genuinely protect your bladder, your sleep, your confidence, and in some cases, even your sex life. Most men think an enlarged prostate is just an annoying part of aging, but after treating thousands of men over the last decade, I can tell you something disturbing. Many men suffer for years without realizing that the medication they were given may actually be causing the dizziness, fatigue, low libido, ejaculation problems, or erectile issues they blame on getting older. And here's the shocking part. Some prostate medications work beautifully with very few side effects for certain men, while others can quietly make a man feel like he's losing a part of himself. The problem is that nobody explains this properly. Doctors are busy, patients are embarrassed, and millions of older men are swallowing pills every single day without fully understanding what those pills are really doing inside their bodies. So today, I'm going to speak to you honestly, like I would speak to my own father or older brother. We're going to talk about the best prostate medications with the least side effects, which ones doctors commonly prescribe, which ones may affect your sexual function, blood pressure, sleep, and energy levels, and how to know what might actually be safest for your body. And I need you to stay with me until the end of this video, because one of the most commonly prescribed prostate medications has a side effect that surprises almost every man when he first experiences it. Now, before we talk about medications, you need to understand what's really happening inside your body. The prostate is a small gland that sits underneath the bladder. When you're younger, you barely notice it exists. But as men age, especially after 50, the prostate often begins to grow larger. We call this BPH, or benign prostatic hyperplasia. That sounds complicated, but all it really means is a non-cancerous enlargement of the prostate. And here's the problem. The urethra, the tube that carries urine out of your body, passes directly through the prostate. So when the prostate grows, it starts squeezing that tube like a hand slowly tightening around a garden hose. At first, the symptoms are subtle. You notice the stream isn't as strong. Maybe you dribble afterward. Maybe you feel like you didn't completely empty your bladder. Then suddenly you're waking up repeatedly at night. You're tired during the day. Road trips become stressful. Movies become interruptions. Some men even become anxious leaving the house. I've had patients tell me, "Doctor, I don't sleep anymore because my bladder controls my life." And what many men don't realize is that poor sleep from nighttime urination can affect blood pressure, memory, mood, testosterone levels, and even heart health over time. This is not just a bathroom problem. This is a quality of life problem. Now, naturally, most men want relief as quickly as possible. So they go to the doctor, get prescribed a medication, and hope everything improves. Sometimes it does. But this is where many men make a dangerous mistake. They assume all prostate medications are basically the same. They are not. In fact, prostate medications work in completely different ways, and the side effects can be very different depending on the drug, your age, your blood pressure, your heart condition, and even your sexual health. Let's start with the most common group of medications prescribed for enlarged prostate. These are called alpha blockers. You may recognize names like Tamsulosin, alfuzosin, silodosin, or doxazosin. These medications are extremely common because they often work fast. Some men notice improvement within days. What these medications do is relax the muscles around the prostate and bladder neck so urine can flow more easily. Think of it like loosening a tight knot around the urinary passage. For many men, the improvement feels almost miraculous at first. The stream becomes stronger, less straining, less urgency, fewer nighttime trips to the bathroom. And this is why millions of men love these medications. But now we need to talk honestly about the side effects, because what I'm about to tell you may surprise you. Some alpha blockers can lower blood pressure, not always dangerously, but enough that older men may suddenly feel dizzy when standing up. I've seen men nearly fall in the bathroom at night because they got out of bed too quickly after taking their medication. And as we age, falls become dangerous. A hip fracture in an older adult can completely change a person's life. This is one reason why medication choice matters so much. Now, among these medications, Tamsulosin is one of the most commonly prescribed because it targets the prostate more specifically and usually causes less blood pressure lowering than older drugs like doxazosin or terazosin. For many older men, that makes it easier to tolerate. But there's another side effect men are often not warned about: ejaculation changes. Some men taking Tamsulosin notice little or no semen comes out during orgasm. The orgasm itself may still happen, but the ejaculation feels different or missing. This can be frightening if nobody warned you beforehand. I can't tell you how many men sit in my office worried something is seriously wrong because nobody explained this possibility. Now, medically, this side effect is usually not dangerous, but emotionally and psychologically, it can bother some men deeply, especially men who still value an active, intimate life. Silodocin, another prostate medication, can sometimes cause this side effect even more strongly. In some men, ejaculation becomes very minimal or absent altogether while taking it. Now, does this happen to every man? No. But this is why personalized treatment matters. One man may tolerate a medication perfectly, while another feels miserable on the exact same pill. And this brings us to an important point most men never hear. The best prostate medication is not simply the strongest one. The best medication is the one that improves your urinary symptoms while causing the fewest problems for your overall life. That includes your energy levels, balance, blood pressure, sleep, sexual confidence, and emotional well-being. Now, there's another major category of prostate medications we need to discuss because these drugs work very differently. These are called 5-alpha reductase inhibitors. The two big names here are finasteride and dutasteride. Unlike alpha blockers, these medications don't just relax the prostate. They actually help shrink it over time by lowering a hormone called DHT, which contributes to prostate growth. This sounds wonderful in theory, and for some men, especially those with very enlarged prostates, these medications can be extremely helpful. But here's the catch: they work slowly. Sometimes it takes several months before men notice significant improvement. And unfortunately, these medications are also the ones most associated with sexual side effects. Lower libido, difficulty with erections, reduced ejaculation volume, sometimes breast tenderness, occasionally mood changes. Now I want to be medically responsible here because internet fear-mongering has made many men terrified of these drugs. The reality is that many men take finasteride or dutasteride without severe problems. But it is absolutely true that some men experience side effects they find very frustrating. And here's something important most men don't realize. Sometimes the symptoms of aging and low testosterone get blamed entirely on the medication when the real picture is more complicated. That's why a good doctor doesn't just hand you pills. He looks at your full health picture: your hormones, your blood pressure, your medications, your heart health, your diabetes status, your sleep, your sexual function before treatment even started. Because if a man already has fatigue, low libido, poor sleep, obesity, diabetes, and stress, then starting a prostate medication may simply make those underlying issues more noticeable. This is why experienced doctors individualize treatment instead of treating every man like a copy-paste patient. Now, let me tell you something hopeful. Many older men do extremely well on carefully selected prostate medication with very manageable side effects. In fact, one medication I often find better tolerated in certain older patients is alfuzosin. Now, this doesn't mean it's perfect for everyone, but compared to some other alpha blockers, some men report fewer sexual side effects while still getting good urinary relief. Again, this varies from person to person, but when patients ask me, "Doctor, which medication tends to help without making me feel worse as a man?" that conversation often includes medications like alfuzosin or lower-dose selective alpha blockers depending on the patient's health profile. And this is where many men make another mistake. They increase or stop medications on their own. Please don't do that. I've seen men stop prostate medications suddenly, develop urinary retention, and end up unable to urinate at all. That can become a medical emergency requiring a catheter. Imagine your bladder becoming so full and stretched that you're in severe pain and physically cannot empty it. It happens more often than you think. Now let's talk about something many men are too embarrassed to discuss openly: erectile dysfunction and prostate medication. This is one of the biggest fears men have, and honestly, I understand why. Many men tell me, "Doctor, I can handle bathroom problems, but I don't want to lose my intimacy or confidence." And the truth is nuanced. Some prostate medications can contribute to sexual side effects in certain men, but enlarged prostate symptoms themselves can also damage intimacy indirectly. Think about it. Poor sleep, constant nighttime urination, anxiety, fatigue, depression, low energy, stress, embarrassment. All of these affect sexual health too. Sometimes when we successfully treat urinary symptoms, a man's energy and confidence improve dramatically. But here's something fascinating. There's one medication that created enormous interest because it appeared to help both urinary symptoms and erectile dysfunction in some men. And when many patients first hear about it, they think it sounds almost too good to be true. That medication is Tadalafil, the same medicine many people know for erectile dysfunction treatment. What most men don't realize is that low-dose daily Tadalafil is also approved in many countries for BPH symptoms. And for certain men, especially those dealing with both urinary symptoms and erection concerns, this can be an incredibly interesting option. But before you assume it's automatically the perfect solution, there's something extremely important you need to know about who should and should not take it. And one hidden mistake older men sometimes make with this medication that can become genuinely dangerous. Most men are shocked when they first hear this because for years they believed medications for the prostate and medications for erections were completely separate things. Then suddenly they discover that one pill may help with both urinary symptoms and sexual confidence at the same time. And naturally, the first reaction is, "Doctor, then why doesn't everybody just take that one?" Because medicine is never that simple. And this is where experience matters. I've seen men do incredibly well on Tadalafil, and I've also seen men take it the wrong way, combine it with the wrong medications, ignore warning signs, or expect miracles overnight. So let me explain this carefully in plain English. Tadalafil works differently from traditional prostate medications. Instead of shrinking the prostate or directly relaxing only the prostate muscles, it improves blood flow and relaxes smooth muscle in the bladder, prostate, and surrounding blood vessels. The result for some men is better urinary flow, reduced urgency, and fewer nighttime bathroom trips. But there's another reason many men become emotionally attached to this medication. They feel more like themselves again. And after treating older men for years, I can tell you something very honest. Many men suffer silently when urinary problems and sexual problems happen together. They may never say it out loud, even to their wives, but inside they feel older, weaker, less confident, less masculine. That emotional burden is real. So when a medication improves urination while also helping erectile function in some men, the psychological impact can be huge. But what I'm about to tell you is extremely important. Tadalafil is not safe for everyone. This is where many men make a dangerous mistake. Some older men already take nitrate medications for chest pain or heart disease, medications like nitroglycerin. Mixing nitrates with Tadalafil can cause blood pressure to drop dangerously low, not a little dizzy low. I'm talking about potentially life-threatening blood pressure drops. That's why no man should casually take these medications without proper medical guidance, especially if he has heart disease, takes blood pressure medication, or has a history of stroke. And there's another thing many men don't realize. Just because a medication helps erections does not mean it instantly restores sexual health completely. Sometimes the real issue is diabetes damaging blood vessels. Sometimes it's low testosterone. Sometimes obesity, stress, depression, poor sleep, alcohol, smoking, or cardiovascular disease are quietly contributing in the background. The penis is actually one of the body's earliest warning systems for poor circulation. In some men, erectile dysfunction appears years before serious heart disease is discovered. So when a man tells me, "Doctor, my erections changed suddenly," I don't only think about sex. I think about blood vessels, heart health, hormones, sleep quality, medications, and metabolic health. This is why treating older men properly requires looking at the whole person, not just the prostate. Now, let me tell you something that may surprise you. Sometimes the men with the worst prostate symptoms are not the men with the biggest prostates. I've had men with moderately enlarged prostates who were miserable, waking every hour, exhausted and anxious. And I've had men with very large prostates who barely noticed symptoms. Why? Because prostate size is only part of the story. Bladder sensitivity matters. Muscle tension matters. Inflammation matters. Fluid intake matters. Sleep disorders matter. Even constipation can worsen urinary symptoms by placing pressure on the bladder and pelvic area. That's why blindly increasing medication doses is not always the smartest answer. And unfortunately, many older men fall into another trap. They start believing stronger medication automatically means better treatment. Not true. Sometimes the safest and most effective approach is actually the gentlest one that controls symptoms while preserving quality of life. I remember a patient in his late 60s who came to see me after stopping his medication because he was terrified by sexual side effects he had read about online. He had spent weeks suffering in silence, barely sleeping because he was urinating constantly at night. By the time he came in, he looked exhausted. He told me, "Doctor, I thought I had to choose between being able to urinate properly and feeling like a man." That sentence stayed with me. Because so many men think exactly that way. But in reality, treatment is often adjustable. Sometimes changing the medication solves the problem. Sometimes lowering the dose helps. Sometimes switching timing from morning to evening reduces dizziness. Sometimes combining lifestyle changes with medication allows lower doses altogether. This is why communication with your doctor matters so much. Most men don't realize this, but many prostate symptoms become dramatically worse because of everyday habits that quietly irritate the bladder. For example, drinking large amounts of fluid late at night. I know many men who drink tea, coffee, or large glasses of water right before bed, then wonder why they wake repeatedly overnight. Caffeine can irritate the bladder. Alcohol can worsen nighttime urination. Even certain cold medications and antihistamines can tighten muscles around the bladder outlet and make urination harder. And constipation, something many older men ignore, can place pressure on the urinary system and worsen symptoms significantly. This is why good prostate care is not only about pills, movement matters too. Regular walking improves circulation, weight control, insulin sensitivity, and pelvic health. Sedentary lifestyles are strongly associated with worsening urinary symptoms over time. And let's talk honestly about weight. Excess abdominal fat changes hormone balance, increases inflammation, worsens sleep apnea, and places pressure on the bladder. I've seen men improve their urinary symptoms significantly after losing weight and becoming more active, not magically overnight, but meaningfully. Now, I also want to address a growing problem I see constantly online: miracle prostate supplements. Men are desperate for relief, so they buy expensive internet products promising to shrink the prostate naturally in 7 days or restore youthful urination instantly. Please be careful. Some supplements are harmless but ineffective. Others interfere with medications. Some are poorly regulated. And many rely on exaggerated marketing designed to target frightened older men. Now, to be fair, certain natural compounds like saw palmetto have been studied for urinary symptoms. Some men report mild improvement. Others notice little difference. But the scientific evidence overall is mixed. And this is important. Natural does not automatically mean safer. I've seen men delay proper medical care because they spent months chasing miracle cures online while their symptoms worsened. One man eventually arrived in the emergency room unable to urinate at all. His bladder was dangerously overdistended. And here's something every older man needs to hear. Not all urinary symptoms are automatically just aging. Sometimes similar symptoms can signal infection, bladder stones, uncontrolled diabetes, neurological disease, or even prostate cancer. Now, BPH itself is not cancer. That's very important to understand. But because symptoms can overlap, proper evaluation matters. That may include urine testing, PSA blood testing in appropriate patients, physical examination, ultrasound, or checking how well the bladder empties. Please don't self-diagnose based only on YouTube videos or internet comments. Use information like this to become informed and empowered, but still work with a qualified doctor who understands your full medical picture. Now, let me tell you what I personally believe many older men actually want when they ask about the best prostate medication. They're not asking for perfection. They're asking for normal life again. They want to sleep through the night. They want road trips without panic. They want confidence during intimacy. They want energy during the day. They want to stop thinking about bathrooms every hour. And the good news is this: many men can absolutely achieve major improvement with the right combination of medical care, medication selection, lifestyle adjustments, and monitoring. But the key is choosing treatment intelligently, not emotionally. Don't let fear push you away from treatment that could genuinely help you. And don't let advertisements convince you that one pill is perfect for every man, because the truth is more personal than that. For some men, a selective alpha blocker like Tamsulosin or alfuzosin provides excellent relief with manageable side effects. For others with larger prostates, finasteride or dutasteride may be useful despite potential trade-offs. For some men dealing with both erectile dysfunction and urinary symptoms, Tadalafil may become an excellent option when medically appropriate. And for others, especially men with severe symptoms or complications, procedures or surgery may eventually become the better long-term answer. That decision depends on symptom severity, bladder function, prostate size, overall health, and how much symptoms are affecting life. And before we finish, I want to say something directly to the men watching this quietly at night while everyone else in the house is asleep. Please don't ignore your symptoms out of embarrassment. You are not weak. You are not less of a man, and you are certainly not alone. Enlarged prostate affects millions of men around the world. The difference between suffering silently and getting your life back often starts with one conversation and the right information. And in the next video, I'm going to talk about the warning signs that suggest prostate symptoms may be becoming dangerous, including one symptom many older men dismiss completely until it becomes an emergency. And trust me, if that symptom starts happening to you, you should never ignore it.